Welcome to the third narrated PowerPoint. By this time, you should be well on your way. The information in this presentation will be focused on sustainment and maximizing the rewards of having consistent assignment. To prepare for this meeting, create an agenda based on the action items from your last meeting. Watch videos 2 and 3 and read Appendix 3 and 4. Again, we've given you a sample agenda. Feel free to modify it or adapt it as you need. The first agenda item is a check-in. You'll want to debrief on lessons learned so far. If you piloted, share how it went and decide which areas to do next. The next item is to plan management check-ins on all shifts weekly for the first month and then monthly thereafter. You may want to make adjustments for changes in census, acuity, and staffing. By having consistency, you need to have nurses who are responsive. So identify at this time any nurse leadership areas that need attention. The last item is to put practices in place to maximize support for and use of consistent assignment. We'll discuss these in more detail in this webinar. Step 10 is all about monitoring, supporting, and using the new information you get from CNAs being consistently assigned. Monitoring and supporting includes revisiting assignments to maintain fairness, hiring into assignments, and monitoring absences and coverage. We will discuss this in more detail. Using what staff know includes individualizing care, having shift huddles for teamwork, including CNAs and care plan meetings, having management stand-ups and QI rounds with the staff. Step 10 is about providing the long-term support that sustains and maximizes consistent assignment. Monitoring and supporting means having a routine way of checking in. Meet monthly to review progress and to troubleshoot issues. Put in place a system to continually monitor your staff's experience. Check in on how well it's going on each shift and neighborhood. Be sure to plan who will check in. This can become something brought up in morning stand-up. Be sure to maintain fairness. Review the master schedule and staff's feedback and work with the staff to make adjustments as needed so that the schedule remains fair and balanced. Continue to review data. This is not a one and done. It's a continuous process, so you'll need to continually collect data on the consistency of assignments and making sure that consistently assigned CNAs are not being moved to cover for unscheduled absences, because old habits die hard. Make sure that this happens, and you'll need to decide who will take this responsibility on. When you have true consistent assignment that is resident-centered, you're in a very different place when you have a vacancy. You're now hiring for the assignment that's open. So your hiring from this point forward will be for a resident assignment. When this happens, be sure to review how well the newly hired staff are working in their assigned areas. They're not just taking this assignment, they're working with a team. Orient them to the unit or the neighborhood where they're going to be working. Be sure to do the same for your part-time and per diem staff so that they're all good, solid, steady backups. Plan with your team how you're going to do this. Monitor absences and coverage. With consistent assignment, scheduling is easier. Call-outs will likely decrease as the bond between staff and residents deepens, but call-outs will happen. Monitor how well your plan is working for coverage without moving consistently assigned staff, and adjust as needed. It can be done, but it needs to have a plan. Decide at this meeting how it's going to happen, and who will take the responsibility for making it happen. To make consistent assignments work, it needs to be nurtured and maintained. We'll now go over some of the practices that maximize consistency. With consistent assignment, staff know residents' choices. They need help from the rest of the team to honor them. For instance, if the CNA now knows that a resident was never an early riser, but now has gotten up earlier than she'd like in order to have her medications and have breakfast, the CNA is now in a position of enforcing a schedule that she knows doesn't work for the resident. The resident may even reject care or have a verbal or physical behavior symptom. Staff can tell you what works best for the resident. Can you realign your schedule so that the resident takes her early morning medicine upon arising and breakfast is still available even later in the day? Another example is a shower. If a consistently assigned CNA knows that this is not a good time for the resident, and the resident has made this very clear, will the CNA be told to just get it done, or will there be flexibility to meet the resident's individual needs? Once staff really know the residents that they're caring for, you put them in an untenable position if they know something doesn't work for the resident, but they are forced to carry out the rules anyway. When the consistently assigned CNA learns that her resident would like to sleep later in the morning, she needs a way to share this information with the nurse, with food services, and with housekeeping to make it happen. The nurse may need to make adjustments in her MedPass timing, and food service needs to arrange for the later meal, and housekeeping has to know so that they can adjust the time that they clean the room. This information is essential for others on the care team to know so that everyone can make the necessary adjustments to deliver person-centered care. Honoring residents' preferences is even more explicit in the July 15, 2015 regulations. When surveyors interview residents, they ask whether the residents' preferences are honored. The more the organization uses CNA's knowledge to shape care, the more CNAs will feel their value to the organization, and the better care will be.
It's a good practice to have the CNA who will be caring consistently for a new resident be the one to gather initial information about the resident's routines. CNAs are providing care from the first day a resident arrives. It's important to have a way to share the information they learn about the new resident across shifts and to other departments. They will share information such as when a new resident would like to go to bed. Usually this information is gathered through the resident assessment process by the activities director as part of Section F of the MDS. When the information is gathered by activities, it doesn't always get to the CNA, and the information often doesn't get to the CNA in time for that first night and the next morning to be as comfortable as possible for the new resident. We encourage you instead to redesign your system so that CNAs ask a new resident about their routines as part of the welcoming process. This is a win all around. The CNA gets to know the resident right away and establish a relationship. The CNA gets to know their person's routines in time to be able to honor those routines that first night. Having the CNA ask only works if the CNA can then honor what they learn. It's crucial that CNAs have a way to share what they learn about a new resident's routines. They need to be able to pass this information along to their coworkers and the nurse needs to be able to pass it along to others. When everyone can honor the person's waking and sleeping times and other personal routines, you can find a way that you're giving a resident a very good welcome at a very delicate time. At one nursing home, the CNAs and nurses work together to identify 5 key questions for CNAs to ask new residents as they help them to settle in. They introduce themselves to the resident and ask how they'd like to be addressed. They ask if the resident would like a freshen up and what is their usual time for a bath or a shower. They say they want to make sure a person is comfortable and has a good first night's sleep, and so they ask what's your usual routine for going to bed and their usual nighttime routine before they go to bed. They say, we want to have you have a good morning, so can you tell us when you usually wake up and how we can support you in your morning routine? And then they ask, is there anything I can do to make you more comfortable? With these questions, CNAs gather important information to care for a new resident and help that person feel comfortable at a high-stress time. At this home, the CNAs had these 5 questions put on the back of their laminated name card so that they wouldn't forget them. The CNA said that having the question at hand made the welcoming process easier for both the resident and the CNA. The CNAs at this home have a form with these questions on it. They fill it out and they put it in a notebook at the nurse's station. Other departments check in on it so that they can adjust meals, meds, and therapy. This nursing home has a high volume of short-term rehab residents. When we were visiting them, they told us about just that day, by asking a resident about their routines, they were able to adjust the time of therapy to later in the morning, once the CNA passed along to them that the person needed a slower start to their day. At this home, since the CNAs have been gathering this information, they have fewer family complaints, fewer rehospitalizations, fewer missed therapy sessions, and better satisfaction from day one. Those first days are critical 30% of rehospitalizations occur in the first 7 days of a nursing home stay. You also don't get a second chance to make a good first impression. CNAs told us they love being able to gather this information as part of a welcoming of a new resident. It gets the relationship off to a great start. The survey guidelines expect that facilities must actively seek this information about residents' customary routines and be proactive in assisting residents to fulfill their choices by making sure that these choices are known to caregivers. What better way to do this than to have the caregivers themselves ask the questions directly? Activities will still do its assessment, but they can check in with the CNA first, and then they can let the resident know they've heard some of this information already. As a guide to what to have the CNA ask, look at the questions that are part of the surveyor's resident interview. Do you have a choice about when you get up in the morning and when you go to bed at night, and how many times you wash up and whether you have a bath or a shower? For residents to have these choices honored, the CNA has to know what the choices are. And for the consistent relationship between the CNA and the resident to be good, the CNA has to be supported by the rest of the organization to honor these choices. Having consistently assigned staff know your residents' routines and be able to honor them should help you be able to reduce the incidence of residents' rejection of care. Often when a CNA knows just how someone likes things done, the person feels comfortable with their CNA and they're comfortable with their care. Remember our paired drinking experience. You might even want to measure how often rejection of care occurs and see if it declines with consistent assignment. If it doesn't decline, perhaps you need to provide more support to CNAs to be able to adjust routines. As we said earlier, if a CNA still has to get a resident up for breakfast, even though it's not a time the person usually gets up, the resident may well be, quote, resistive, and this is an indicator that the care isn't working for them at this time. You put your CNAs in a tough position if they always care for the same person and they know the person wants something different, but they can't provide it. To maintain consistent assignment, use what staff learn about their residents and help staff be able to honor residents' routines and preferences. Talk this through in your team meeting. How do you handle it now? When a resident wants to sleep in, can they have a later breakfast? Is their med pass adjusted? Are there trouble spots now? How will you hear about what staff are learning so that you can support staff to provide individualized care? You can start making changes on a one-by-one basis, but eventually you'll need to be able to make adjustments to meal times and med passes for all your residents. Many nursing homes are moving to more open dining, and the July 15, 2015 regulations highlight the importance of this. Many homes are adjusting their med pass to each person's routine. Instead of set times, they use upon rising, at meals, before bed. The California Culture Change Coalition can help you work on this. Individualizing care is key to success with consistent assignment. Who from your committee will take the lead on figuring out how to hear from staff and how to act on what you hear? You'll need to create a communication infrastructure to hear quickly from staff closest to the resident so that the whole organization can back staff up in individualizing care. The more you act on what your staff know about residents, the more they will feel good about consistent assignment. The more you see the value in their knowledge, the better you'll be able to sustain consistent assignment because you will come to depend on staff's knowledge in order to give your best care. To act on staff's knowledge, you need to know what they know. We have found 3 practices to be key for the whole organization to hear from consistently assigned CNAs and to use what CNAs share. The first is having a regular management presence every day through morning meetings, a quick stand-up or rounding on each neighborhood with the management team and the staff. Watch video 2. It shows how 3 nursing homes implemented this approach. One does it every day, and the other do it 2 or 3 times a week. It doesn't take long. In fact, it saves time because managers hear about needs immediately and can address them on the spot. Listen in the video as one DON says it helps her validate interventions, and another uses the time to figure out together with the staff what the best intervention is for each situation. One of the DONs has taken most of her clinical meetings out into rounds. She does her wounds, her weights, her behaviors by talking with the staff closest to the resident about the situation and figuring out a solution together. Another essential practice is the shift huddle. With a huddle, everyone working on the hall hears from each person about each resident, so staff can back each other up. Huddles are quick and problem-solving oriented. Appendix 3 is a tip sheet on huddles. Another practice is involving CNAs in the care plan meeting. The July 15, 2015 regulations call for CNA involvement. It makes sense. They have the most up-to-date, specific information about a resident's ADLs, how they're eating, their mood, what they like to do, and families really appreciate this information. When you have consistently assigned CNAs, families and residents feel more comfortable in the care plan meeting when their CNA is there. Appendix 4 is a tip sheet on involving CNAs in care planning, and Video 3 is a short film about how one nursing home involved their CNAs. Review this material before the meeting and consider whether or not you want to show some of this material, show some of these videos at the meeting. Now let's get into these practices in more detail. First, though, here's the theory behind the practices. When staff have ways to share information frequently and the information that's timely and accurate, then staff can problem solve together. Then they're in it together. They have shared goals, they share their knowledge, and they appreciate what each other brings to the discussion. You want to aim to have frequent, timely ways to be communicating within and across shifts, within neighborhoods, and across all departments. This idea of regular communication is actually a theory called relational coordination, because it recognizes that communication doesn't happen just by wishing for it. It happens by putting structures in place that support it to happen. This theory of relational coordination was tested in nursing homes in Massachusetts. The homes in Massachusetts where staff routinely shared information and problem-solved together had better clinical outcomes and better staff outcomes. Staff felt their value because they were able to share what they knew and see it be used. The communication is most effective when it is with and among the staff closest to the resident. If you meet in a conference room, you leave with a big to-do list, and you have to go to the staff working directly with the resident to get most of your answers. Why not save a step, save some time, and have the meeting as a quick stand-up right there with the staff who have the information? Think about how often you design an intervention in the conference room and then it's not implemented as written. If staff think it through with you, they will implement it because they help shape it in a way that is most likely to work.
Management stand-up with staff is a way to use what staff know about residents and to give staff information. The more information people have, the better they're able to do their jobs. View the second video to learn how 3 homes took this on and the benefits that they got. Most homes have a 24-hour report that is a tool for capturing what's happened. It's a good practice, but it's a reaction to what's already happened. If you add to this, putting in place a watch list for those residents that you're most worried about, you'll be moving from being reactive to being proactive. Homes that have moved to using a watch list report that their 24-hour report actually shrinks as their watch list grows. Consistently assign staff or your partners in this because they spot the subtle changes. Let them know in your morning stand-up who you're worried about and find out from them who they're worried about. Then you can make a game plan for action. This practice may help you to prevent avoidable adverse events. When you take the morning stand-up out of the conference room and move it to the floor and include the direct care staff, you get immediate information coupled with people in the meeting who can make things happen. It also provides an immediate way to hear about subtle changes, changes that are so subtle that they may not make it to the 24-hour report because they are so subtle. But these subtle signs may be early warning signs that something is brewing, and you may be able to be on top of the situation before it gets full-blown. Watch video 2 to see how 3 Indiana homes took this on.
For any meeting you now have in a conference room, consider whether you can carry out some of your business by rounding. The closer your deliberations are to the residents and the staff caring for them, the more likely you will have accurate information and an effective intervention. In rounds, meet with the staff and the nurses, the CNAs and the nurses, to discuss each resident you're concerned about. Find out who the staff are concerned about. There might be residents who haven't shown up on your radar yet that the staff can help identify as needing help. Talk through potential approaches. Always follow up and make adjustments. Staff are likely adjusting, Be in it together, and your clinical teams will be so much more effective. When you're doing QI rounding for falls or behaviors or weight loss or pressure ulcers, here are some questions to ask in a quick huddle. What do you think are the possible causes? What can we do about them? Is there something that's easy to change? And here's an important one. What help do you need? And then, how will we know it worked? And who else needs to be involved? Use QI rounds to investigate adverse events such as falls or residence decline. You can round on your 24-hour report or round on your watch list. Do clinical rounds on people you're concerned about for weights or wounds or distressed behavior. If your QAPI team is working on a performance improvement project involving residents on a neighborhood, round to check in with the staff on how it's going. It can be a challenge to get these meetings going. Staff may find it hard at first to break free from their regular duties. Have someone available to watch the call lights while you huddle with the staff. Keep the meetings very short and focused. If the meetings are quick and productive, staff will join in. As they do participate, they'll understand more about why certain protocols are in place. And as they are involved in shaping those protocols, they'll be more likely to follow them or to let you know why not when you come back. As a committee, talk about how to take some of your QI work out of the conference room and engage with consistently assigned staff. Decide where to start, how it will go, and who will take the lead. The next area is huddles. See Appendix 3 for tips on huddles. Huddles are a regularly scheduled meeting, a quick gathering of the CNAs and the nurses working together on the same unit. Every day they come together to share information and coordinate action. Most homes do it near the beginning of a shift so that everyone has the information they need for the day. Some homes also do it near the end of the shift so they can share information about how their residents were doing and anything that needs to be passed along. This is particularly helpful for catching early warning signs that a concern is brewing. Homes that have paid overlap between the shifts can do a combination of rounding and huddling. But it's important that the CNAs and the nurse meet together. This is part of the nurse's leadership in making sure her team has the information they need and is a chance to hear what consistently assigned staff are seeing about the residents that they're taking care of. Shift huddles normally take about 15 minutes and occur at least daily on each shift. The huddle generates information that, when it's shared across shifts and departments, provides timely information to the rest of the organization. CNA's information about residents' abilities and needs and routines can be used to update the care plan. The key to success is that the meeting is short and to the point. Focus on report by exception, what's not usual. It's a time for CNAs to share anything unusual about their residents and for nurses to provide the medical information and context, what to watch for. These are teachable moments. For example, if a resident with respiratory issues may be at risk of pneumonia, and a CNA mentions that the resident didn't seem like herself today, she didn't have her usual energy, then the nurse could say, well, these are the symptoms of pneumonia, and ask the staff if they're present. How's she eating? How's her strength? Are there concerns? If there are concerns, they can make a game plan. Let's monitor the vitals. Let's get a chest x-ray. Let's see how she's eating. And staff problem solve together. And then the nurse needs to close the loop and let the CNA know that the chest x-ray came back, and yes, there were early signs of pneumonia. Because the CNA was so observant, we caught it early, we've started an antibiotic, and let's keep updated on how she's doing. It is in these exchanges of information and problem solving that you get the real benefit of consistent assignment, and staff know that their contribution is truly valued. If you don't have shift huddles and are looking for a place to start, consider having huddles for new residents. Staff really appreciate having information before they walk into a new resident's room. It helps them to be prepared to provide good care. Even when your information might be incomplete, share what you know. You'll find that the staff will hustle over to get the scoop on the new resident. Come back the next day and check in on how the new residents are doing and any needs they have. You can do rounds or a quick huddle for residents on your watch list. Go over the protocols for any at-risk residents. Ask the CNAs who they're worried about and if there's anyone they need to have added to the watch list. Another way to start huddles is after an incident like a fall. After the resident is attended to, gather the staff for a quick huddle to capture what they saw and brainstorm what can be done about it.
CNAs who are consistently assigned have a tremendous amount of knowledge about their residents. You want to mine this knowledge. Harvest this win by involving them in the care planning process. They're going to be a huge asset, but only if your care planning process is a good one to begin with. So you're going to want to assess your care planning process at this point. To assess your care planning meetings, think through, are they a checkoff? Do they have real problem solving that happens in the meeting? Do people come on time, and are they prepared? Are they productive? Are the meetings person-centered? You might even want to consider where the meeting's held. Is it easy for the residents and the CNAs to get to? Think through this. Consider moving the meeting to the neighborhood. Consider holding it in the resident's room. But only include CNAs once you have a well-functioning meeting. Appendix 4 has guidance on improving your meetings and involving your CNAs. To involve your CNAs in care planning, make sure that they're well prepared and know how to contribute. When CNAs routinely share at shift huddles, this helps them know how to share in a care planning meeting. To prepare CNAs, consider having a training to introduce them to the meeting format. Let CNAs know what to share. Then plan how they're going to participate. Hold the care conference where they can easily get to it. And then in a huddle, let them know which residents are in their window and which are scheduled to go that day for the care planning meeting. See video 3 for how one nursing home took this on.
The Pioneer Network has a free starter toolkit with tip sheets, video clips, and starter exercises for getting these practices in place. Look on their website under Provider Resources. The Pioneer Network also has a more detailed handbook on how to implement these practices, and it's for sale at the Pioneer Network bookstore. There are a lot of tasks to take on for this meeting. With the team, decide who will do what and realistically how much time you need between now and the next meeting to accomplish this. See the grid and the guide for this list of tasks. Some of these will take a while to get up and running. However, by using these practices, you will make the most of consistent assignment. Use the grid to make your assignments. And set a meeting date for the next meeting for sharing the results of the assignments and taking the work forward. This is the end of this part of our audio guide. The next webinar is for use in staff training. So we'll end with a reminder that consistent assignment needs your consistent attention, making sure the assignments are fair. Keep tapping into what your staff know. Keep helping staff problem solve together for their best results for your residents.